Hi, I'm Dr. Gregory Apsey at 11270 13 Mile, located between Hoover and Van Dyke in Warren, Michigan. You can reach me on the web at drapseydds.com. I'd like to talk with you about a common problem that many of my patients are faced with through the years. It is cracked tooth syndrome. And it's often seen in patients who either have just bitten on something very hard, inadvertently they've fractured their tooth, or they on a regular basis are clenching their teeth. Clenching of the teeth is a biting together and a squeezing, and it's often happening during the day. If you find yourself doing that, during the day, it's something you can avoid, you can prevent, you can stop yourself from doing it. But in general, people who are doing it during the day are also doing it at night, and generally at about 10 times the force at nighttime. So what can happen over time is that a tooth can split or can begin to split. As this process begins, in the beginning there may be a visible fracture on the tooth. I would be able to detect that in my chair on a routine examination. But you may also find it on your own, that all of a sudden you are not able to chew on this side of your mouth. Something's bothering you, something's hurting, and you really would rather stay off of it. Meaning every time you chew or when you let off pressure, you're feeling pain. This is a reason, a very good reason to get in to see the dentist, because if the tooth is fractured, there's a potential that fracture will continue. Usually, once it started, it's going to continue working its way down into the structure of the tooth. If it goes too deeply, it can get into the nerve of the tooth, causing a need for root canal and crown. If it's even beyond that, the tooth can sometimes be lost due to fracture right down the root. So there is a pretty simple diagnosis that's done in the office. Usually there is an x-ray taken, and I'll do a test with a bite stick. We call it the tooth sleuth. But this tooth sleuth helps us to diagnose where the fracture is, or if indeed there is a fracture. And then we can talk about whether the tooth can be saved or not. It really depends on how advanced or how deep the fracture is. So if you find yourself with a toothache when you're chewing food, don't put it off. It should be looked at least to rule out fractured tooth. Thank you.